orthodontics, the three-dimension technology in our office and the chance to build up our own aligners homemade in the office. Happy to hear Dr. Lecoq. Thank you for coming.
Thank you. Thank you for a very kind introduction. I'm glad to be with you today here in Vienna, and I would like to thank the organization committee for inviting me, and especially Dr. Castroflorio for giving me the opportunity to do this lecture today. As mentioned, I'm Dr. Guillaume Lecoq, and I have my private practice in Valenciennes, north of France, close to the Belgium border. And I also work in Paris. I am the scientific director of the postgraduate in lingual orthodontics and aesthetics at Paris 5 University, where we practice both lingual and aligner therapy, like I'm used to doing in my practice. And in my office, I also have a 3-shape intraoral scanner and 3D printers. The fact is that this new 3D technology has created a new paradigm. It has greatly improved my practice, and I'm certain that it would improve yours. The fact is that technology has already dramatically changed our life. Do you remember the first mobile phone 30 years ago? It looks old, but you looked pretty cool when you had one. He's not my father, despite the mustache. Fortunately, there has been a clear progression in mobile technology, so that today you all have this kind of sophisticated smartphone with internet access and time-saving applications. We are all connected to the world from the palm of our hands. And the corollary of this digital revolution is the dematerialization. Yesterday, we used to make these kinds of impressions. Now they are becoming virtual. Yesterday, you needed to be an engineer or a programmer to use 3D software. But now, 3D software are so intuitive and so easy to use that even my 3-year-old daughter can use it. So you can imagine how easy it is for my lab technician and my nurse to use 3D software. But what for? How do I manage this digital flow? How do I govern the data? Well, I would like to show you, with a case, the way 3D technology would improve your daily practice. Let's talk about Tom. I'm sure you all have a Tom in your office. You know, he's one of your brother's patient's brother, and his mother was delighted with the treatment on his sister, and therefore she asked you if you can do the same thing. But he's a nice boy. He does not like his smile, nor the toothbrush. What would you do for him? Would you bond brackets despite the poor hygiene? Now, I think we all agree aligners are the best option. But what are the difficulties to treat this patient with aligners? First, we want to close the diastema. This is the chief complaint. But we also want to change the dental arch form, and we want to control the deep bite, because we know that by repositioning the incisor lingually, you will get an increased deep bite. But as now we know the difficulties, we can properly plan the simulation and comprehensively prepare the prescription form so that your lab technician can offer you the simulation. And then you decide on the number of sets of aligner to move teeth. And for this patient, I asked 6 steps of aligners. Let's have a look at the simulation, and please be attentive to the second molar movement and to the dental arch form modification. It's a very ambitious movement, don't you think? And on the lower arch, we plan the same challenging movement, look at the premolar and the bicuspid. On the 6th aligner, you ask for overcorrection. It is quite a challenging treatment plan, don't you think? 6 upper and 6 lower aligner to restore a full and comprehensive occlusion. Yes, it's challenging, but as you have a complete control of the process, you can be ambitious. What about attachment? Well, do you think that failure or success of your treatment depends only on the attachment? When you analyze the situation of the bracket on market, they are all underlain by a philosophy. Treat, demon, safe ligating. Anyway, the question is, do you think that this is science or philosophy? Do you think that attachment design is a science or philosophy? My conclusion is that it's not bracket science. And as far as the goal of the attachment is to increase the contact between the teeth and the aligner, any kind of attachment shape that will allow to increase this contact will make an efficient attachment. That's why, for this case, I used only a simple drop of fluid resin, and that was enough to enhance the pressure on the teeth. And look at the result. Before the treatment and after the treatment, I have a good control of the deep bite, a good repositioning of the incisors. I have, of course, maintained the class 1 molar and canine on the right side and on the left side, and you can see the repositioning of the incisor. What about the upper arch? Look at the huge amount of movement. And it matches with what has been planned. And on the lower arch, we have the same precision. You can see it with this 2D superimposition. But do you think that these 2D superimposition are sufficient to assess, to evaluate the treatment? We don't live anymore in 2 dimensions. We live in 3 dimensions. And if you want to evaluate your treatment, we have to use 3D superimposition. You have the 3D model of the end of your treatment, and you have the 3D model of the setup. Then you can superimpose these 2 models, and as you can see the deviation, and all teeth are white because it matches perfectly. And despite the amount of movement, there is only a slight deviation on the second molar, and you find the same result on the lower arch. I think it's quite a good treatment with only 6 upper and 6 lower aligner. It means 12 weeks of treatment, and with Acceleron it would have been 6 weeks of treatment, but I'm quite happy with this result. And if we want to put this process into 3 words, we can say that it's simple, because you perform your diagnostic and impression as you are used to doing. It's controlled, because you have a direct dialogue with your technician. No need to send email to the 4 corners of the world. And it's effective. I've just shown you with a 3D superimposition. So we have an individualized, a fully individualized process. Is it possible to individualize treatment with a standard process? It's possible. We are used to doing it. But I think there is another way to do it. If you have any question about this process, I will be very happy to meet with you afterward. Thank you very much for your attention.
Absolutely great. I 100% agree.
Thank you.
Can I have your business card?
Yeah.
So we
Okay.
stay in contact. So we
Okay.
stay in contact.